Hello everyone, my name is Ankur and welcome to RJPT Simlab simulation. In this video, we will study about the Pyrogen test on rabbit by performing the SHAM test or SHAM test. At the end of this video, we will be able to tell about that whether any product is safe or not before using it or after using it by performing the Pyrogen test on it. So now let us start with the video. At first, let us see the introduction part. The introduction part says pyrogens, often referred to as fever inducing substances, trigger a state of hyperpyrexia or high fever. The most prevalent type of exogenous pyrogen is bacterial endotoxins. Whether bacteria, viruses, malarial, parasites, and fungi enter the body, they release certain chemicals that function as pyrogens. So, the first paragraph explains about pyrogens that pyrogens are water pyrogens, they are fever inducing substances. They are fever inducing substances, which means they causes fever and they trigger a state of the body, which is also known as hyperpyrexia or high fever. Hyperpyrexia is a body temperature in which body temperature rises from above 106.7 degrees Fahrenheit to or more, or we refer to it as an high fever state. And the most prevalent type or the most basic type of this exogenous pyrogen bacteria is are the endotoxins. These are the toxins. When bacteria or virus or malarial parasites and fungi enter our body from the environment, they release certain chemicals or some chemicals from them which are known as or as that function as pyrogens, which causes the fever, which causes fever inside the body. When the sterilization process eliminates these microorganisms, the residual pyrogens in their products can provoke a febrile response. Therefore, pharmaceutical products undergo two types of tests: sterility test, which confirm the absence of microorganisms, and pyrogen test, which ensures the absence of pyrogens. So, this paragraph says that even after through the sterilization process, by killing all the microorganisms, by eliminating these microorganisms, the residual or the leftover pyrogens in the products that we use in our day-to-day life can provoke a febrile response or an effective response. So, therefore, pharmaceutical products, the products that are produced in the pharmaceutical industries, our medicines and our pharmaceutical cosmetics that we use undergo some certain kind of test. Basically, two types of test: sterility test and pyrogen test. Sterility test we perform because it confirms the absence of microorganisms, and pyrogen test it ensures whether the pyrogens are present inside the product or not. The absence of pyrogens. What are pyrogens? As we know that we have seen, these are fever inducing substances. Then, one of the most common pyrogen is lipopolysaccharide (LPS), which is found in gram-negative bacteria. There are several methods to test for the presence of pyrogens, including the Limulus amoebocyte lysate (LAL) test or the LAL test, and the rabbit test, also known as the SHAM test or SHAM test. So, this paragraph says that the most common pyrogen that we know is the lipopolysaccharide or LPS. This is a common pyrogen that is found in the gram-negative bacteria. And to test this presence, to test its presence, there are several methods such as we call it LAL test, and full form is Limulus amoebocyte lysate test, and it is also known as rabbit test. And for that, for the rabbit test, we use the common term SHAM test, SHAM test. Now let us see the equipments required to perform this experiment. For at first we need the apparatus. The apparatus in apparatus we required rabbit holder. We are performing this experiment on rabbits, so if we require rabbit holder, then cotton swabs, surgical knife, digital thermometer, telethermometer. We are using telethermometer and syringe. We are using syringe of 5 milliliter. Then subject, we require rabbit, so we require 4 rabbit, which should weigh more than 1.5 kg. Then drugs, we are using surgical spirit, we are using pyretic drug, antipyretic drug, and WFI, which stands for water for injection. Now let us see the principle of this experiment. The principle part says that the principle of sham test, also known as the rabbit test that we have seen earlier, is centered around the detection of pyrogenic substances in the pharmaceutical products. The test utilizes the physiological response of rabbits to these substances, which is an increase in the body temperature. So this para says that we are performing the rabbit test or sham test to for the detection of the pyrogenic substances in the pharmaceutical products that we have known. And this test utilizes the physiological response of the rabbits. So the physiological activities or the response of the rabbits are observed, and when which is an increase which is due to the increase in the body temperature of that. So whenever any pyrogen enters the body of the rabbit, the body temperature of the rabbit increases, which shows that the pyrogen is present. Then, in this test, a sterile solution of the substance under examination is injected intravenously into a healthy rabbit. The rabbit's body temperature is then monitored for a specific period. If the body temperature rises beyond a certain threshold, it indicates the presence of pyrogens in the substance. So, what we are doing in this experiment or test, that we are using a sterile solution. As you know, sterility means absence of microorganisms or killing of all the microorganisms. Then under the examination, and we are injecting this sterile solution through the IV route or intravenous route into the a healthy rabbit. We are using a healthy rabbit. Then if the body temperature of the rabbit is raised, then it shows that it indicates the presence of pyrogens inside the substance, the sterile solution. If the body temperature rises of the rabbit, then it's important to note that the sham test is preliminary test performed on rabbits that do not have been used in a pyrogen test during the previous 2 weeks. This test conditions the rabbits by injecting them with a pyrogen-free saline solution, which helps to ensure the reliability of subsequent tests. So this paragraph says that the sham test is a preliminary test. Before performing the main experiment, this test is performed as a preliminary before test, so that the rabbits and on the rabbits that do not have been used before for the any pyrogen test, and we are using this test on conditions by the rabbit injecting with them pyrogen free solution, saline solution, which helps to ensure the reliability of the sterile solution on our subsequent tests. Now, the fundamental goal of the sham test is to safeguard the health and safety of the patients by ensuring the pharmaceutical products are free from substances that could induce a febrile reaction. This test is a crucial part of quality control in the pharmaceutical industry. So, this paragraph says that the fundamental or the main goal for performing the sham test is to safeguard or to be in a safe side towards the health and safety of the patients by ensuring that the pharmaceutical products that are manufactured are free from those substances that can induce or that can show a febrile reaction, or such as we can say they are free from pyrogens. So that's why this test is a very crucial part of the quality control, the QC department in the pharmaceutical industry. Now, the important points. At first, for this experiment, the selection of the test animal is a very important point. Healthy and adult rabbits of either sex, male or female, are chosen for the test. Then these rabbits should be of the same variety and should not weigh less than 1.5 kilogram and should not show any loss of body weight during the week preceding the test. Okay, and no rabbit should be selected if it has a normal temperature greater than 49.8 degrees Celsius or it was used in a positive test during the last 2 weeks. So So we are performing this before performing the main experiment. So now, second, the preparation part. The rabbits are housed individually in an area with uniform temperature and humidity, free from disturbances. They are put in a retaining boxes 1 hour before the test. The equipment, injectors, and needles used in the test should be pyrogen free. So the all the preparations and the equipments we are using should be pyrogen free, and the individual rabbits should be maintained of the temperature and the humidity in the places they are kept. Now, third, the injection part. The test involves a measurement of the rise in the body temperature. So, we are measuring the rise in the body temperature of the rabbits following the IV route injection of the sterile solution. We are providing with the sterile solution with the IV route under the examination. Now, the fourth, the temperature measurement. We are injecting the solution and we are observing the temperature rise in the body temperature. So, the temperature measurement is a very crucial part. An accurate temperature sensing device such as digital telethermometer. We are using this device, digital telethermometer, is inserted into the rectum of the test rabbit to depth about 7.5 centimeters. So we are using this instrument and we are inserting this the part of this instrument inside the rectum part of the test rabbit, of about 7.5 centimeter. So the temperature is recorded after a period of time not less than 30 minutes. So we will record the temperature of the rabbit by this digital telethermometer. Now let us see the observation table or of the observation that we will get. As we can see here, this is the chart which is prepared against the temperature and the time. The rabbit's temperature, rise in the rabbit's temperature and the time after the drug treated. As we can see here, if the rise in the temperature occurs, we will perform this experiment according to this. If the temperature is raised, then it will from the 0 minute to the temperature will be risen according to the time. And then after administering the drug, it will fall down. Now let us see the procedure part of this experiment. We will drag four rabbits. So we are using four rabbits as an all instrument used in the practicals into lab environment, beaker, syringe, digital, telethermometer. Now, then after that, we will check the initial temperature of all the four rabbits by thermometer. So at first, we have to check all the four rabbits' temperature. Then now, after that, we will put the pyretic drug in the first three rabbit and water for injection in the fourth rabbit. Viewing of the marginal view by cutting hair of the ear by surgical knife. Putting surgical spirit by cotton. Putting pyretic drug by syringe to marginal vein of 0.5 to 1 milliliter per kilogram dose and water for injection by syringe to marginal vein 0.5 to 1 milliliter per kilogram dose. So this point says that first we will induce the pyrogens. So we are using a pyretic drug which will raise the temperature, which will induce the pyrogens inside the body. And we are using the pyretic drug for the first three rabbits. And then for the fourth rabbit, we are using water for injection. At first, for that, we will view a marginal vein by cutting hair of the ear. We will cut the hair of the ear by the surgical with the help of surgical knife of the rabbit. Then we will put the surgical spirit. We will put the surgical spirit by cotton, and then we will put the pyretic drug with the help of the syringe with the help of syringe of about 0.5 to 1 milliliter. And for the fourth rabbit, we will inject water for injection to the marginal vein of about 0.5 to 1 milliliter per kilogram dose. And after that, we will wait for 30 minutes and then we will check the temperature of all the four rabbits by thermometer and note down the readings. Then we will put the antipyretic drug in the first three rabbits. Then putting the antipyretic drug by the syringe to a marginal vein, we will put the 0.5 to 1 milliliter per kilogram dose. Then after that, again, we will wait for 30 minutes. We will check the temperature of all four rabbits by thermometer and then we will note down the readings. And then we will see the observation graph. So this is the procedure part. And now we will perform our experiment. And for that, we will perform our experiment in our RJPT Informatics Simulatory Laboratory. As we can see, this is the UI interface of our simulatory laboratory. On the left sidebar, we can see the rabbits are placed over here. All the four rabbits are placed of the different weights. On the right side of the toolbar, we can see the instruments that we will use for performing this experiment. A surgical knife, syringe, digital telethermometer, then cotton swabs. On the bottom side, we can see the instruction part, which will provide us the procedural part for performing this experiment. On the top side, on the top left, we can see our drugs. At first, we can see the surgical spirit is placed. Then we have the pyretic drug, through which we will induce the pyrogens. Then we have the antipyretic drug, and then we have the water for injection. On the top, we can see observation drop-down table. Here we have our observation table, inside which we directly the temperature of the animals will be written. We have the columns of temperature without the drug, then temperature with the pyretic, then temperature with the antipyretic drug, then temperature with the water for injection drug after 30 minutes and after 60 minutes. So we have these five rows. And as we can see, these are the graphs for the first, second, third, and fourth, all the rabbits. Now, by clicking this procedural flow button, we can see the flowchart of the procedure. This is the flowchart for performing all the procedures of this experiment till the completion. And by clicking any button, we can directly jump to that step, and we can directly move to any step. So now we will click the observation table and we'll move this upwards. And now we will perform our experiment. And at first, the instruction says that place all the four rabbits in the lab. So we will click one by one, and all the rabbits will be placed on the laboratory table. As you can see, rabbit one, 2, 3, 4, and now drag the digital telethermometer in the lab by clicking it or to grabbing the lead. So we can place it by clicking it or by grabbing it. So we will grab it over here, and our digital telethermometer is placed on the table. And now we will click on it to grab the lead. So as we can see here, we have grabbed the lead. This is the lead of the thermometer. And now we will select any rabbit. So we will click on the first rabbit, select, and now we will check the initial temperature of the all the four rabbits. So by clicking this check temperature button, we will insert our thermometers part inside the rectum portion of our first rabbit, and we will check the temperature. The temperature is 38.87. This is in degrees Celsius. Now, after that, we have checked our first rabbit's temperature, and one by one, we will check the temperature of all the rabbits. We will check the first rabbit's temperature twice, so that to check the working of the instrument, whether our instrument is working properly or not, for the confirmation. Now we can see the temperature shows the same, which means our instrument is working properly. Now we will select our second rabbit to check its temperature. We will click the check temperature button, and we will insert our digital thermometer's end and we will insert it inside the rectum portion of the rabbit to about 7.4 centimeter inside. The temperature is 38.16, which is the normal temperature of the rabbit. Now we will check the temperature of the third rabbit. We have to perform this part very carefully so that the animal does not feel any pain. Again, we will remove it, and now we will check the temperature of our fourth rabbit. By clicking this check temperature button, we will insert the lid of the thermometer inside the rectal part of the rabbit, and we will check the temperature. As we can see, the temperature is 38.40. So now we can see on the observation table that the temperature without the drug is directly written on the table. The first one was 38.88, second one was 38.16, third one was 38.22, and the fourth one was 38.40. Now we'll move further in our experiment. Now drag the surgical knife into the lab and click it on the grab on it hand. So we will click this, and then the knife is placed on a table, and we will grab it by clicking it. So as we can see, we have grabbed our knife, and we will select our first rabbit. And now we will cut the fur with the knife. We will cut the ear furs of the knife so that a vein is visible. As we can see by cutting all the hairs of the ear, we can see this is the marginal vein that is clear. Now we will drag the cotton plate from the right side toolbar. We have placed it on the table, and now we will click on it, one of it, to grab it. We have grabbed it, and now we will drag the spirit drug in the lab. Back click on it, apply spirit cotton, then click apply cotton to clean the one rabbit one vein. So we will bring the surgical spirit, and we will dip our cotton swab inside the surgical spirit. And after that, we will apply cotton to the vein of the visible vein of the rabbit's ear. We have applied the surgical spirit so that the area is clean, and now we will throw our used cotton swab in this trash bin. Now after that, now we will drag the syringe plate on the laboratory. I have grabbed it. We have grabbed it now, and we have to select one syringe. By clicking this syringe, we have selected our syringe, and now we will drag the pyretic drug in the lab, and we will, by clicking this pyretic drug button over here, we will drag the pyretic drug over here. Now we will select. We will load our syringe with the pyretic drug. As we have seen, we have load over here, and now by clicking the apply syringe button over here, we will apply through the intravenous route, this visible route, we will apply our pyretic drug. We have to perform it very slowly and very carefully. Similarly, we will perform it for the second rabbit also. We will click our surgical knife, and we will clean the hairs of the ear of the rabbit. We will cut the fur with the knife. As we can see here, with the help of the syringe, we're cutting the hairs so that this vein is very visible to us. Now we will select a cotton swab and then we will dip it inside the surgical spirit and now we will apply the cotton. Slowly we will apply the surgical spirit and now we will throw the used inside the trash bin. And with the help now we will administer and insert our pyretic drug with the help of a different syringe. We have to throw each and every syringe after use so that it does not cause any contamination to rabbit. Now similarly we will do it for the third rabbit also. We will hold our knife and we will cut the fur of the rabbit. We have to do it very carefully so that we does not damage the ear of the rabbit. Otherwise, it will cause bleeding and our experiment will be ruined. After that, we have to select the cotton swab and we will dip it inside the surgical spirit. And after that, we will apply cotton to the rabbit. And now we will throw it into the trash bin. Now, after that, we will select a syringe and we will load it with the pyretic drug. And now we will apply syringe to the rabbit ear. As we can see, the vein is very clear to us. Slowly, we will administer the drug. And now we will throw this used syringe into the trash bin. And now, as we can see, the countdown, the back counting has been started for the pirated drug to act. We can skip it by clicking the skip button. So we will move forward through our experiment. After skipping it, now we will check the temperature of the rabbit 1, 2, 3 as the pirated drug has been acted on it. So we will select our first rabbit and by selecting this temperature thermometer, we will check the temperature of all the rabbits. At first, by inserting the end of the thermometer, we will insert inside the rectum of the rabbit. And as we can see, the temperature has been raised. The temperature is 42.10 degrees Celsius. Similarly, we will check the temperature of the second rabbit. We have to perform this part very carefully so that the rabbit does not feel any pain inside the rectum portion because we are inserting it inside till about 7.54 centimeter inside. The temperature of the second rabbit is 42.044 degrees Celsius. Now for the third rabbit, as we can see, it is 41.92. Now we will take a cotton from the cotton swab and select the first rabbit. Before that, we can see the temperature with the pyretic drug. The temperature is written over here. Now we will move forward in our experiment. We will select our first rabbit and we will dip the cotton with the surgical spirit. And now we will apply cotton to the first rabbit. We will clean this portion very carefully and very neatly. And now we will throw the used cotton swab in the trash bin. And now we will select a syringe. And now we are selecting the syringe so that we can induce and inject our antipyretic drug. So by clicking this, we can keep our antipyretic drug over the table. And now we will load our syringe with the antipyretic drug. We can use any pyretic and antipyretic drugs for this experiment. Now we will apply our syringe to the first rabbit. So carefully we will administer and inject our antipyretic drug. Now similarly we will perform it for the second rabbit. We will take a syringe from the. We will at first before that we will select a cotton and clean the area with the surgical spirit. We will apply the spirited cotton to clean the ear portion so that the vein is very visible to us and it reduces the chance of any contamination. Now we will throw our used cotton and we will select a syringe and load it with the antipyretic drug. And after that, we will apply the antipyretic drug to the second rabbit. And after that, similarly, we will perform it for the third rabbit. We have to select a cotton swab, dip it inside the surgical spirit, and now we will apply the cotton swab spirited one to clean the ear of the rabbit so that it kills the microorganisms near around it. It sterilizes it, and now and the vein is very visible to us. We will throw the used cotton swab, and now we will take a syringe and we will inject our antibiotic drug to our third rabbit. We have to carefully perform this part of the experiment so that the rabbit does not get damaged or harmed. Now we will throw our used syringe. And now, as we can see, the countdown has also again started for the drug to act, for the antipyretic drug. We can skip this portion by clicking the skip button. We have to wait for 30 minutes, and after that, we will check the temperature for all the three rabbits. By clicking this telethermometer, we will hold its end and we will check the temperature of the first rabbit. By inserting it inside the rectum part of the rabbit, we will check the temperature. As you can see, it has decreased from the after the pyretic drug. After the pyretic drug, as we know that it was increased, but after the antipyretic drug, again it has decreased. It came to 40.12 degrees Celsius. Now we will similarly do it for the second rabbit. You will check the temperature carefully. We have to perform this part very carefully so that the animal or rabbit does not feel any harm or pain. As you can see, it is also 40.12 degrees Celsius. The temperature has been reduced. Similarly, for the third rabbit, we will check the temperature, and the temperature is, as we can see, 39.85, which means it has been decreased. Now, as we can see on the observation table here, this is the temperature with the antipyretic drug, which is after the antipyretic drug, the temperature has been reduced to 40 for the first from 42 to 40, then for the second rabbit from 42.04 to 40.12 similar, and for the third rabbit from 41.92 to 39.85. As we can see, which shows that the antipyretic drug has shown its effect and decreased the temperature. As we can see, the graph of these of the rabbits, as we can see for the first rabbit, the temperature rose after the pyretic drug. This blue line shows the pyretic drug's graph from the temperature and according to the time. And after the antipyretic drug, which is denoted by the green line, it has been decreased. Similarly, for the second rabbit, from 38 degrees Celsius to 42 degrees Celsius. And after the antipyretic drug, it has been reduced to 40 degrees Celsius. And before the drug, the yellow spot shows a without drug portion, which was a normal temperature for the same all the three rabbits. Now, we have to select our fourth rabbit and we have to grab a knife and now we will perform it with the fourth rabbit. Similarly, we will cut the fur with the knife for the fourth rabbit to clear its ears hair so that our vein is visible. As we can see, the vein is visible to us, ear vein. And now we will select a cotton from the from the cotton plate and dip it inside the surgical spirit and we will apply spirited cotton to clean the ear of the rabbit. This will make it visible for us to see the vein and it will disinfect the area. After that, we will throw the used cottons and now we will select a syringe from the syringe blade and now we have to inject water for injection to this rabbit. So we'll select this water for injection from this portion. As we can see, it has been placed on the table. And now we will load the syringe with the water for injection. And now we will apply the syringe. As we can see, we will slowly apply this water for injection to the rabbit's ear very carefully with the help of the syringe. And after that, we will wait for 30 minutes to we will wait for 30 minutes so that we can observe the reaction of the water for injection. So we can skip this part. And now we have to select the fourth rabbit and we have to select the telethermometer and check the temperature of the rabbit. After 30 minutes, we will we are checking now the temperature of the rabbit. As we can see, it is 38.4 degrees Celsius. And now again we will wait for 30 minutes more to check the temperature of the rabbit after the 60 minutes. So again we will wait for 30 minutes. We can skip this countdown portion. And again we will select the fourth rabbit and check the temperature. So that after the 60 minutes time interval, temperature has been recorded. We will insert this thermometer's end portion inside the rectum portion. And now, as we can see, it is still the 38.4 degrees Celsius temperature. So now we have completed our experiment, and by clicking this exit button, we can directly see the result portion. But before that, let us see the observation table over here. This is the temperature with the water for injection after 30 minutes, which is 38.4 degrees Celsius for the fourth rabbit, and after 60 minutes, it is the same temperature. But as we can see, this is the save observation button. By clicking this, we can directly jump on to this area where our observation table is present over here, and the graphs and points which shows the temperature of the all the four rabbits after the drug and before drug and after the antipyretic drug. We can write our name over here, we can write our roll number over here, and we can print it and save it for our further studies. Let us see the let us move on to our experiment and let us see the discussion and result portion. The result says start with the three rabbits. If their total temperature has been risen less than 1.4 degrees Celsius and no rabbit temperature has been risen by more than 0.6 degrees Celsius, then the product is safe, which means if the total temperature risen is less than 1.4 degrees Celsius, total temperature, which means of all the three rabbits, is less than 1.4 degrees Celsius, then no rabbit's temperature risen by more than 0. And if none of the rabbit's temperature is risen by 0.6 degrees Celsius, then the product is safe. If it's less than 1.4 or more than 0.16, then the product is safe. But if any rabbit temperature rises by 0.6 degrees Celsius, if any individual rabbit's temperature is risen by 0.6 degrees Celsius or more, or if all the rabbit's temperature concludes or totals to more than 1.4 degrees Celsius, then the product is unsafe, which means the total of all the three temperatures should be less than 1.4 or the individual temperature of the rabbit should be more than 0 risen by more than 6, then it will show the safe product is safe. Should not be raised by this much. And if it is raised by 0.6 for individual rabbits or the total of the temperature by 1.4 for all the three rabbits, then the product is unsafe. So after testing all the four rabbits, if the total temperature rises less than 3.7 degrees Celsius and no more than the three rabbits have temperature risen by 0.6 degrees Celsius or more, then the product is safe. If not, the product is unsafe. It says the same part for all the four rabbits. The total of all the four rabbits' temperature should be less than 3.7, and no more rabbits should be individual temperature should not be risen by 0.6. If this is the condition, then the product is safe. If not, then the product is unsafe. Then the product refers to as pyretic or water for injection drug. Now we can see the observation table from here by clicking this. This is the observation table as we have seen earlier, and the graphs portion. The first rabbit's graph, which was before without the drug, was 39 degrees Celsius or 38 point something, which is 38.88. Then after the pyretic drug, it has risen to 42.10 degrees Celsius. And after that, after administering the antipyretic drug, it has fallen to 40.12, as we can see from the graph. Similarly, for the second rabbit, before the drug, it was 38.16. After the pyretic drug, it has been risen to 42.04. And after that, after antipyretic drug, it has been decreased to 40.02. For the third rabbit's observation graph, the without the drug, the temperature was 38.22. After the pyretic drug, it has been risen to 41.92 degrees Celsius, and after the antipyretic drug, it has fallen to 39.85 degrees Celsius. As we can see, the difference is of 2 degrees Celsius in all the conditions after the pyretic drug and before the after the antipyretic drug. And for the fourth rabbit, we can see that the temperature was same 38.40 without the drug, and after the water for injection after 30 minutes it was 38.4 similar, and after 60 minutes also it was 38.4, which means the water for injection was pyrogen free. So this is how we test the pyrogen. We do the pyrogen testing of the products of the pharmaceutical products. So now we have completed our experiment. I hope that you have learned a lot about in this experiment about the pyrogen testing, the sham test. So now we have come to the end of this video. Thank you guys for watching this video, and for more such learning content, subscribe to our YouTube channel RJPT Informatics. You can also follow us on our LinkedIn profiles, on our Instagram pages, and as well as in Facebook. We update and upload our such learning content over these platforms. Thank you.